Salam and hello everyone, welcome back to the channel. I hope that you are all doing well. In today's video, I am going to be doing a quick dive into what you can expect when fibroids start to shrink. Now on my channel, I have talked a lot about how to manage fibroids, either naturally through herbs or through diet. I also talk about how to manage fibroids through medication. And then of course there is post-treatment that many of you might be aware of. Noticing the changes in your body is very important for you, especially if you're experiencing fibroids and you are expecting changes to happen, whether you're on medication or post-treatment or post-procedure. You're going to want to understand what you should be expecting. And some of you may not have tried anything particularly, but you might start to notice some changes in your body. And so you're going to want to be aware of what these are. Again, I do want to encourage any of you women watching to please speak with your primary provider and make sure you are well aware of what to expect. Or if you are experiencing fibroids, just some things to know on how to manage and treat fibroids. It's very important for us to be aware of that. So in this video, I want to go through the top 5 signs that your fibroids are shrinking. Hopefully they are shrinking, plus some stats to know how common these changes really are. So the first thing that I do want to talk to you about is the sign that your fibroids are shrinking are lighter and shorter periods. Now, if your period used to be heavy or last more than a week, that was a telltale sign that you are having some heavy flow and some complications with the fibroids. But now that they're lighter or shorter, it's often the first sign that fibroids are shrinking. That's because smaller fibroids cause less irritation to the uterine lining, and therefore during your menses, you don't see a lot of bleeding, or even in between menses, you don't see the bleeding that you normally saw. One thing that I found from a particular study from the University of Michigan, or Michigan State University, I should say, was that 40 maybe to 50% of women notice an improvement in their menstrual flow as the fibroids in their uterus start to shrink. So as they start to regress. So that's really a good sign, whether naturally or after therapy, they're seeing that fibroids are shrinking, so they're having less menstrual flow. So if you're noticing that, keep track of that month to month. Keep track of that. Make sure you tell your provider. And if there's any type of procedures or examinations that need to be done, then you can follow up with them. Now, the second thing that I want to mention is that a top sign that women are experiencing a shrinkage in their fibroids is that women experience less pelvic pressure or fullness. Many women have described fibroids as having a heavy feeling in their pelvic area or their abdominal region. It's heavy, it's bloated, it's just feeling uncomfortable in the lower belly. And this fullness starts to fade when fibroids start to shrink. It's a great sign that fibroids are getting smaller and putting less pressure on your uterus and nearby organs. In one study out of the International Journal of Women's Health, this study found that women whose fibroids decreased by at least 20% or greater reported a 30% reduction in pelvic pressure and discomfort. So that was really good to know. And I'll leave a link to that article, that research article below. Now, a third sign that your fibroids might be shrinking, they include fewer bathroom trips or bowel changes. This is really important because with fibroids that grow and enlarge the uterus, a lot of women may have experienced frequent urination at night, as well as constipation, because that pressure in the abdominal region and in the uterus was pressing on the bladder and other surrounding organs. So shrinking fibroids means less pressure in your bladder and bowels. So if you, again, find yourself having to use the bathroom less at night, less urination, less constipation, it's a good sign that your fibroids are shrinking. Pelvic imaging studies show that large fibroids greater than 5 centimeters, so that's the size of a plum or a lime, can increase urinary frequency by 2-fold. So even a modest reduction in size can have a noticeable relief of symptoms. And again, monitor these symptoms. Make sure that you are tracking yourself and that you understand what changes in your body are happening, because these are good signs, but you want to make sure this is what's actually happening and follow up with your provider, as I mentioned earlier. Now, the fourth sign that your fibroids might be shrinking are less abdominal bloating and visible belly size. When fibroids shrink, a lot of women have commented that they don't look pregnant. anymore. They don't have that pregnant look that they've been carrying around for months or for years, or even, a significant amount of time after their babies have been born, if they have delivered babies. Some women haven't had children yet, and they find that they were looking pregnant, but they no longer look pregnant, and that could be a sign that your fibroids have shrunk. Now, this is especially common for women after menopause, who, when we have a decline in our hormones as women, we find that there are certain changes, and this is one of the changes. And I mentioned this in a video about women who, after 40, what can they expect with their fibroids if they have experienced fibroids after a certain age. And there are also certain treatments that some women may take that may lower fibroids. And again, so that you understand, fibroids is a hormone dominant condition. So we're looking at an increase in estrogen levels that might cause fibroids to grow, to be causing complications for women. So check out my fibroid playlist to get a better understanding about fibroids, and also check out the video that I just mentioned about women over 40 and what they can expect with their fibroids as they are getting older. One thing you should know that I also found from the Michigan State University research study was that 7 to 40% of fibroids shrink naturally within 6 months to 3 years, depending on hormone levels and age. So that's good information to know. Now, the fifth and final sign that I wanted to share with you is that some women experience less pain during intimacy, or they have pelvic pain relief. So if pain during intercourse or chronic pelvic aches start to fade, that's another sign that your fibroids might be shrinking. Fibroids can press on nerves or nearby tissue, causing deep pelvic pain. So when they shrink, that pressure releases or eases. And again, you'll have to get a full diagnostic and an examination from a qualified physician, somebody particularly or specifically who might be an OBGYN and who specializes in urogynecological issues with women. So that might be a good thing for you to think about. There was a particular study done out of New York that found that fibroid shrinkage after menopause or GnRH-based therapies led to a significant drop in pelvic pain scores, improving quality of life in over 60% of women. And that's a big deal. We need to know what is being found in the research, because not a lot of funding is allocated towards women's research, but things are slowly changing. But we still need more investigation and understanding of why fibroids happens, because it occurs in 70 to 80% of women. And I mentioned this before. And so it's really important for us to understand how to manage fibroids, how to shrink fibroids, what to eat, what to do, how to exercise, how to manage it, whether holistically or through medication, or even if you need a procedure to be done by your physician. Now, one thing I do want to tell you is that lighter periods, less pelvic pressure, fewer bathroom trips, and a flatter belly can all be signs that your fibroids are shrinking. These are good signs, but you want to be sure, and that's why you want to work with your healthcare provider. And like I said before, the best way to confirm is through a physical examination or through ultrasounds or MRI. I mentioned it in this video here about the certain treatments that are available and how to actually diagnose fibroids. So if you notice your symptoms are changing, or please track them and then present them to your provider, because that's a good way that you can be a little bit more proactive about your health. I hope that this video has been very beneficial for you. Don't forget to like, comment, and subscribe. And I thank you for watching, and I shall see you in the next video. Take care. Bye.